everyone, and welcome to the special simulcast of the Neil Haley Show and Doctales. I'm excited to welcome my co-host, Royal Doc Alan Lindeman. Doc, what's going on, man? I know you're excited about our guest.
We sure are. We're doing really well here, Neil. And you?
I'm doing great. So who is our guest today?
Well, we've got Dr. Eric Fleegler, and he's into peds and anesthesiology. And he's written a lot about pain medication and management for children and adults. You're also into, I think, gun control. I think anybody who's been in the ER worries about that. So just tell us a little bit, Eric, about Dr. Fleegler. How did you get into ER and peds?
Thank you very much for having me. So as you said, I'm a pediatric emergency physician. And when I was in medical school, I did my pediatric rotation and just realized that was the place where my heart belonged. Loved working with kids, loved working with families. Did my pediatric training in Boston at Boston Children's and Boston Medical Center. And then during that time, we rotate through all the various places. And it was the emergency department that really just drew me. It was the chance to be with patients, and when they were kind of in these moments of crises, to have an opportunity to figure out, but more importantly, to be there for them and to help them out. And with my training in emergency medicine, I also did training in research. I did a health service research fellowship, not a master's in public health. And the focus of my work has been around basically three areas, which are understanding family social needs and how to help them get connected to services, firearm research and understanding how to reduce firearm fatalities and injuries in our country, as well as understanding disparities across a range of subjects.
Very interesting. So kind of, and I'm going to go, Doc, the question I have first for Dr. Fleegler. Here's my thought process on this. So basically, you're not in pediatrics, going to emergency medicine. That's a pretty big different step, right? Working with kids to then emergency meds.
No. I'm a pediatric emergency medicine doctor. I do exclusively kids.
Oh, exclusively kids. Okay, that makes complete sense. So basically, from your experience in doing this, moving up the ladder and being part of this, you saw that there's so many things that are happening with kids that can be controlled and stopped, right? When they get to that emergency room based on certain things, right?
Absolutely. So much of what happens especially in a child's life, is not necessarily determined by them, but determined by the environments they live in. And trying to understand, one of the things we like to think about in emergency medicine is we'd love to put ourselves out of business. So I try to think about how to prevent them from coming to the ER.
So do you actually see patients in the ER now? You're so busy. You're doing so many things.
I basically have multiple full-time jobs. I'm a full-time pediatric emergency physician. 7 a.m. I'll be in the ER tomorrow. And this morning I was doing sedations for patients and then doing my research in between. So it keeps me very busy.
And what's made you kind of look out there to get yourself out there in the media to talk about who you are? And this, because you go through such a long day as doctors, and I know this, and the hours and different things from clients of mine who are doctors, and just to put yourself out there to give. Is it giving back in a lot of ways? Is it wanting to make change where you're seeing such a hole in these, just the visits and who ends up in the ER and stuff?
Yeah, that's a great question. There are many reasons why patients end up in ERs, and some of them are out of our controls. We have an asthma attack, we develop pneumonia or ear infections. These things happen, and sometimes there are reasons why some groups might get them more than others. But a lot of the times when people end up in emergency departments, it's because of a lack of access to resources. Now, that may be healthcare resources, it may be things related to like what we call the social determinants of health, food insecurity, housing problems. We see patients who come in who are homeless and experience not just being homeless, but the health consequences of it. We see kids who come in from violence, kids with mental health problems. And all of these things basically motivate me to say, how can I do more? How can I be with them? What leads me to do research is basically something that hurts my heart, something where I say, this doesn't have to be like this, and I want to people do better.
Well, it sounds like you had a lot of experience with a lot of things, and certainly I want to ask you a little bit about violence. You see injuries in children. What percentage of your ER practice is violence?
Yeah. So, as I'm sure you are aware, violence is not equally distributed throughout our country. And so, when it comes to emergency medicine, where you work will really determine very much about the types of violence you see. So, in our emergency department, where we take care of about 60,000 kids a year, probably about a quarter of those are injury related types of things.
Hmm.
But the majority of the injuries that we see at our place, because of where we're located in Boston, are more oriented towards your sports and bruises and normal stuff, with a smaller percentage being specifically people being hurt from either being shot or stabbed or getting into fights. But if you go downtown a couple miles from where I work to Boston Medical Center, it's a completely different story. And in a place like Boston Medical Center, they see the majority of our firearm injuries that occur in Boston. Thankfully, in Massachusetts, we have very, very low rates of firearm violence compared to many other states in our country. But that's where it is. And so while the percentage of patients that I personally treat on a daily basis, specifically from violence, is relatively low, I do see many, many patients with severe mental health concerns and people thinking about suicide and depression, which is always been a problem with kids, but became almost intractable during the COVID pandemic, and we're still trying to figure this out.
Well, in obstetrics, that's what I am. I graduated my residency in 81, so a long time ago. But the number one cause of death now with mothers is what we call behavioral. So it's in educated white women, it's suicide. But for colored women, it has to do with um, homicide. Of course, you don't see much, you don't see pregnant women, but certainly that is a problem that we are seeing more of.
Oh, absolutely. And I can tell you some of the numbers. So, as you've said, I do a lot of my research is in firearm injury violence and trying to understand it. In the United States, there are about 3,000 women a year who will die from firearm homicide. 50% of those firearm homicides are intimate partner violence related from current or previous partners. And it's like as I said before, it's not evenly distributed. If you are an African American woman in the United States, the likelihood of dying from intimate partner violence is fivefold greater than white women in the United States. And as you correctly pointed out, suicide, which affects everybody, has its highest rates among the white population and as well among the American Indian and Alaska Native populations.
And there's such involvement in mental health, Dr. Fleegler, that we're really seeing is one of the biggest issues that leads to all this violence, right? Is the mental health, the lack of really figuring out the right mental health resources for children and then and families, because that's where all this develops and it leads to these things, unfortunately, and specifically some of the biggest cities.
Yeah, the mental health crisis, it's important to think about when we think about violence. Mental health, probably the greatest, not probably, the greatest impact is certainly going to be around suicide. There's a very close and obvious link between suicide and mental health problems. And when we think about firearm violence specifically in our country, in 2021, there were over 48,000 people who died from firearms in our country. 60% of those fatalities were from suicides. When it comes to homicide, it's really not about mental health, although we frequently hear about that, especially with mass shootings, but is about interpersonal violence. It's about high rates of gun ownership and conflict that is, we're turning to the guns for resolution.
Well, yes, suicide, I've always said, is a permanent solution to a temporary problem. So you're right about the weapons. If they weren't there, you wouldn't have those 5 minutes to think about it.
Oh, the data when people think about suicide is really amazing. When you think about lethal means, how lethal is it your action? So when most people try to commit suicide in the United States, 85% of them will use pills or other type of harm. The fatality rate when they're at that desperate moment with a pill overdose is about 3%. However, if a gun is in the house and it's used, it's 91%.
Yeah.
So it's a huge difference. And that's why even though guns are only used in 5% of attempts, they account for close to 50 to 55% of all fatalities.
It's crazy to think about those numbers and everything that happens and what can be done next to help children and help families in so many ways. What do you recommend, especially going out here and talking about this, how we can change some of this narrative?
There's a lot of things that can be done. The first and foremost, may I pause so I can just stop that phone from ringing?
Sure, sure. Go ahead and do that. We'll just keep it rolling until that happens.
Apologize about that.
Okay.
Serious questions and not so serious phones. So what can be done in the mental health crisis and suicide specifically? First, the mental health crisis has blossomed in ways that we're still grappling with. And if you come to the emergency departments, you will see it in a truly profound way. We have a 50-bed ER. On average, any given evening over the last 2 years, we can have 25 to 30 of our beds occupied by patients who are there just waiting for placement, for psychiatric placement. This is a chronic problem that has gotten so bad during COVID. We sometimes have patients who wait a week or more in our emergency departments just waiting for placement. That's just wrong. We need much more mental health resources available to them. And of course, it's not just about having inpatient units for these kids to go to, but we need psychiatric therapists who can come and help and work with these patients. And it's a phenomenally underserved community of people who need this type of help. But going beyond that, we try to, of course, prevent people from dying. And so, as I mentioned, if you have access to a gun, the likelihood, if you attempt to kill yourself, is very, very high. You lose the opportunity to have regret. You lose the opportunity to make a phone call. You lose the opportunity for somebody to find you and get you help. So part of the solution is trying to, limit access to firearms, in particular by kids. And part of that is either not having a gun in your home, especially if you have a child with mental health problems, or at a minimum, keeping the gun appropriately locked up and inaccessible. Locked and accessible doesn't help. Locked up and inaccessible, and likewise keeping the ammunition locked up and inaccessible to those kids.
Well, I can tell you at 75, I've never had a weapon in the house, and I have 3 children, so I didn't have to worry about them shooting anybody. But it is amazing, I think, you have an uphill battle with trying to get weapons out of the house.
It is challenging. I approach it from a number of ways. And I'll say I was raised in a family that had guns, and I have many relatives who are gun collectors and avid shooters. So I've been around it. When I talk to parents, especially when they bring in their kids who have been severely depressed and are thinking about suicide, I take an assumption that they want their kids to be safe. And I think that's fair whether you own a gun or you don't. You want your kids to be safe. These are the most precious parts of our lives. And so when I talk to them, we kind of go through understanding how are they taking care of, say, the pills first, and talk about locking them up and emphasizing it's not just about the kids' medicines, but it's the parents' medicines, their siblings' medicines, the Tylenol and Motrin. Those are all things can harm. And they get it. And it clicks. Okay, yes, I can do this. Well, then I talk about the guns. And I ask them if there's a gun in a home. And regardless of whether they say yes or no, I tell them why I'm asking. And the reason is because of the lethality and how they can get a hold of these and what happens. And what is remarkable is the families who talk about their own gun ownership, the most common comment when I get to the point about talking about why you want to lock them up and about possibly you've been getting them out of the house and bringing them to that bank safety deposit box or a gun shooting range, the most common comment I get from the families is, I hadn't thought about it. It's not that they don't believe in safety. It's not that they don't want their kids to be safe. It's at this framework of, I've trained my kids about proper gun usage, about how to be safe around them. I've taught them if you find a gun, you don't touch it. These are the frameworks with which that these families are taking, but not recognizing there are actually downhill consequences once you reach depression.
Depression is impossible to get there. So I think your mission is both twofold: mental health and also gun awareness, to make sure that the kids, that they lock up their guns, protect them, different things. It's not eliminating guns, it's making sure that they're safe. And ultimately, at the end of the day, you have your house locked and you have a gun locked up. You can easily get that gun out of your safe if there's an intruder. You don't have to have it out and about. It's like, allowing a pit bull, if you have a pit bull living in your house, to be not chained up, right? In different ways. it's a conversation that needs to be out there. Not,
Yes.
you're not promoting gun control, you're promoting gun awareness and safety.
And gun
that's
safety.
that's
You know,
powerful. Yeah.
I was just thinking about, I mean, one of the first things we did when my kids were little was to house proof. You know, they can still get into soap and Drano and all kinds of other dangerous equipment. They can pull the frying pan off the stove. There's all kinds of ways they can get injured, but house proofing is something that everybody needs to do before they get their first child.
Yeah, and that's a great point. With all those things that you mentioned, what we're typically worried about is kids getting injured. But when it comes to guns, just by the very nature of them, we're almost always worrying about the kids dying. It's a whole nother framework.
Is there a place we can find information on you, Dr. Eric, and learn more about you?
Absolutely. So Boston Children's has a way to look up the doctors that are there. And if you type in my name, you'll find me. I've also written a book with one of my colleagues, Lois Lee, on pediatric firearm injuries and fatalities, available on Amazon. And then, I'm a member of a lot of organizations and I do a lot of writing. I've published over 100 papers. So they're out there and they're happy to have you take a look. And I'm always happy to communicate with people.
All right. We appreciate it. Thanks again for stopping by.
Thank you for having me. I appreciate it.
Thank you,
All right.
Dr. Fleegler.
All right. That was a special simulcast of the Neil Haley Show and Doctales. Take care, guys.